Welcome to Roughing It with Ruth, the channel where everything is a bit rough around the edges. I'm Ruth, and in this video I'm going to take you along with me as I have a MOHS surgical procedure to cut out some skin cancer on my face. This is the skin cancer that I'm going to be having cut out. It's kind of like a little pink circle at the moment because that's where they took the biopsy to determine that it was in fact a basal carcinoma, a basal cell carcinoma that needed to be cut out. It is the night before my MOHS procedure, and this is actually the second time that I'm having a MOHS procedure. The first one that I had was for a basal cell carcinoma on my forehead. You can kind of still see that white looking scar. That's where I had the MOHS procedure previously, when I had this basal cell carcinoma cut out. For a couple of days afterwards, it was a little bit challenging to wash my hair and clean myself properly. So I just want to start out as clean as possible, and also psychologically it just makes me feel better to be nice and clean for the day of the surgery. And then I've also obviously packed my bag with all of the things that they have asked me to bring along. I'm also going to be taking my Kindle along because part of the MOHS procedure is that they do not close you up immediately. They cut out the skin cancer and then they go and have a look at it in the lab to determine whether they've got all of it out or not. And if they haven't, they take you back in and cut out a bit more. But that whole process can take a little bit longer, so you end up having to wait in the wards or in a waiting room for a little while. So bringing something to do along with you to the clinic is a really good idea. Good morning. So I woke up this morning just before 6 to have some breakfast, and I have to be at the clinic at 8. Last time I went for a procedure like this, I had like a low ponytail to get my hair out of the way, but that eventually got a little bit uncomfortable. So I'm thinking of maybe doing like a twist on either side to keep my hair out of the way so the back of my head doesn't have anything on it. You're not allowed to wear any lotion or cream or makeup, so I'm not going to be putting anything at all on my face. Oh good, now the comb is tangled in my hair. Yeah, so other than doing my hair and brushing my teeth, I'm pretty much done. Okay, so I've got my hair tied up. I also decided to wear a button-up shirt just in case I have to get changed. I don't want to have to mess with pulling things on and off over my head in case there's bandages or stitches or something. I'm also just kind of mentally preparing myself for the fact that I am going to have a wound and stitches and bandages and a scar in this area. The other thing that my doctor recommended is that someone else drive you to this procedure in case you do need to get sedation or something. Obviously you can't drive a car at that point. So my husband's going to be taking me. He's actually staying with me the whole day today, and I've taken the whole rest of the day off work because you also don't know exactly how long the procedure is going to be. Depending on how many times they might have to take you back to cut more and more out. It's pretty much time to go, so I'm gonna head to the hospital. I don't know how much I'll be able to film there, but I'll try to at least take a couple of pictures and clips and stuff. I'm in my gown in the hospital place. Ralph's here with me. And they've just done the whole admission process thing. And yeah, now we wait for the actual cutting. Took me way too long to
This one.
Right, so the nurse just came and put some numbing cream on here to help for when they put the local anesthetic in, and marked off where the area is that they need to cut. Okay, so this is me looking like I've had my third eye opened. I just went and the dermatologist cut out this little lesion, and she's going to now have a look at it in the lab, and if they need to cut out more, they'll cut out more. I'm just waiting back in my ward. Right, so I had to go back in for another round of cutting. I think it was on this side. They had to cut a little bit more because there was still some cancerous cells left there. And I just got back from that. It is now 1:10 in the afternoon. I arrived here at 8. I think the first cutting bit was about 9:30. It's now 1:10. And then obviously once everything is completely clear, the closing up still has to happen. So can be the whole day, definitely. But the theatre part of it is actually not that scary. You just have to lie on like a table that can tilt and move, so they move you around to exactly the angle that they want you. And then because it's on my face, they drape my whole face and they put coverings over my eyes. And then there's a very, very bright theatre light that you can kind of like see through your eyelids while the doctor's working. And there's like a electrical thing that she uses to burn closed little bleeding blood vessels. But other than that, I mean, with the local anesthetic, you can't feel anything. And the doctors and nurses here are very, very nice.
I just got back from having the plastic surgeons close my wound, and I had to do a flap, so I had some sedation, which is why I'm very sleepy. But it was fine, and it's now 5 o'clock in the afternoon.
Okay, so the reconstruction closure has been done already. They do have an anaesthetist to give you sedation. So I had some propofol through the drip. Obviously, when they put the drip in, it's like a little bit of a needle stick. And the propofol kind of burned when they put it in, but then you just go to sleep and wake up after a little while and then have some food, which I was very grateful for the food because it has been like 12 hours since I ate anything, so I was quite hungry. But I'm feeling okay now. I can feel here a little bit. I can feel it's going to be a little bit painful, but I've got all my medication to go home with, so ready to get out of here and get back to real life. If you've watched all the way to the end of this MOHS procedure with me, then thank you so much, and I will be posting follow-up videos about the whole recovery process as well. And just remember to keep an eye on your skin, get regular checkups. If you're concerned about something, then bring it up with your doctor. If you enjoyed watching this video, then you can subscribe to my channel if you'd like to see videos that I'm going to make in the future, or you can click on my channel name to see videos that I've made in the past.